You know that ache, right? That nagging feeling in your joints? We all get it from time to time. But what if it's not just about getting older? What if it's actually a clue? A clue in a really complex medical mystery? Well, today we're going to put on our detective hats. We're going to look at two very different cases of joint pain, follow the evidence, and see if we can crack the code of arthritis. Our investigation starts right now.
And really, that's the big question, isn't it? Because not all joint pain is the same, not even close. The signals our bodies send us can point to completely different problems. And if you misinterpret those signals, well, you could end up with the wrong treatment and a lot of unnecessary pain. That's why gathering the right evidence is so critical, and that's exactly what we're about to do. All right, let's open up our first case file. Inside, we have the story of a woman dealing with this persistent stiffness. And in any good investigation, every little detail matters. So let's dive in and look at our first clue.
Okay, so here's our patient. She's a 45-year-old woman. Now that age is interesting, right? It's not exactly what you'd call old age aches, but it's the specific symptoms she's having. That's where the real clues start popping up, and our case really starts to take shape.
And here is where things get really interesting. Just look at this pattern of evidence. First off, the swelling is symmetrical. It's happening in both hands, both feet, at the same time. That's a huge clue. Then there's the stiffness. This isn't just a little morning achiness that goes away in a few minutes. We're talking stiffness that lasts for over an hour. And finally, look at this. Symptoms that affect her whole body. Fatigue, weight loss, all backed up by lab tests that show widespread inflammation. This tells us it's not just a joint problem. There's something much bigger going on here.
So we have our evidence. Now it's time to line up the usual suspects and see which diagnosis actually fits this very specific profile.
Looking at this table, it's like a process of elimination, and it becomes crystal clear. Could it be osteoarthritis? No, doesn't really fit. The stiffness is usually much shorter, and it's often not so symmetrical. What about gout? Well, that's usually a sudden, intense attack in just one joint. But rheumatoid arthritis? Look at that. It's a perfect match. The symmetry, that prolonged stiffness, the systemic symptoms, it checks every single box.
The evidence is pretty overwhelming, right? We can confidently close our first case. The diagnosis is rheumatoid arthritis. But, solving the who just leads us to the next big question. What exactly is this thing? And this is the absolute key distinction. Rheumatoid arthritis is not a disease of wear and tear. It's an autoimmune condition. Basically, the body's own defense system has gone rogue. It's mistakenly attacking the lining of the joints. And this internal battle is what causes all that inflammation, the symmetry, and those whole body symptoms like fatigue. But hold on, our investigation isn't over yet, because not all joint pain reads from this script. It's time to open our second case file and check out a completely different set of clues. All right, meet our second patient, a 60-year-old man. So a bit older than our first case, but pay close attention to this detail, a 40-year career in construction. As you're about to see, that is a critical piece of this puzzle. Now, just look at how different these clues are from our first case. This time, the pain is in the big, weight-bearing joints, his knees and hips. And it gets worse when he's active and better when he rests, the complete opposite of what we saw before. That 40-year career in construction points to a long, long history of mechanical stress. And here's the clincher. The X-rays show osteophytes. Those are bone spurs. This is hard, physical evidence of changes inside the joint itself. So we've got our new clues on the table, and they are telling a very different story. Let's bring our suspects back in and see which one matches this new set of evidence. Right away, you can see rheumatoid arthritis is a really poor fit here. The symptoms aren't inflammatory in that systemic way, and the joint pattern is all wrong. But osteoarthritis? It's a bullseye. The pain gets worse with activity, it's in the large joints, and you've got those classic X-ray findings. It all points directly to one diagnosis.
Yep, the evidence is undeniable. Our second case is solved, and the verdict is clear: osteoarthritis. But this diagnosis points to a fundamentally different kind of problem.
So this is the classic wear and tear arthritis that most people think of. It's not an autoimmune attack. It's a degenerative process. The protective cartilage in the joints just gradually breaks down from years and years of use and mechanical stress. Like 40 years working on a construction site. The body then tries to repair itself, and that's when it forms those osteophytes, or bone spurs that we saw in his X-ray.
Okay, so we've solved two very different medical mysteries. But this isn't just about solving a puzzle.
For anyone out there experiencing joint pain, understanding this difference is absolutely critical because the why completely determines the what's next. And here it is, the core takeaway, laid out right next to each other. On one side, you've got rheumatoid arthritis, a disease of internal attack. It's inflammatory, it's systemic. On the other side, you've got osteoarthritis, a disease of external stress. It's degenerative, it's mechanical. They might both cause pain, but they are two completely different culprits.
And that is why cracking the code matters so much. You can't treat an autoimmune attack the same way you treat mechanical wear and tear. One needs medications to calm down the entire immune system, while the other is more about managing pain, physical therapy, and preserving mobility. Getting the diagnosis right is the first and, honestly, the most important step to getting effective relief.
Ultimately, your body is constantly sending you signals. That little ache, that stiffness, it's not just random noise, it's a clue. The real challenge isn't just to hear it, but to listen carefully enough to understand what it's really trying to tell you. So, are you listening to the right clues?